Good morning, Mayor, ENA Board. Thank you for asking me to participate today and providing this update. Before I get started, let me give you some background on who we are and what we do. I'm Mark Nash, President of Pinnacle Partners West, based here in Edmond. Pinnacle is a management consulting firm that focuses on process and quality improvement in a wide variety of industries and sectors, including healthcare and government. Me personally, I'm a Six Sigma Master Black Belt and Lean Manufacturing expert. I work with my business partner, Dr. Sophronia Ward, a PhD statistician who is based in Knoxville, Tennessee. We've been analyzing certain COVID-19 related data since last April. Our analysis does not look at the medical or healthcare aspect of the pandemic, but rather we've been studying the social processes as they relate to both public and private policy decisions. To that end, we settled on the purest data available, new cases reported daily. This data does not tell us the actual number of new cases, since some people who are asymptomatic or have very few symptoms never get tested. But from this data, we can understand how a community is responding to both public and private policy decisions. Specifically, I've been analyzing new cases reported daily in Edmond, and Dr. Ward has been analyzing data for Knox County, Tennessee. We have multiple meetings each week and discuss our findings as we interpret what is happening in each community. Let me emphasize before we go any further that the numbers we are studying tell us how the local population is at following policy decisions and what effect that has on the spread of the virus. Good or bad, our public leaders want to make decisions that have the least negative impact on the community while keeping us safe during a pandemic. Our goal is to provide real data, real interpretation of what's happening and has happened to help make those decisions moving forward, not try to forecast what is going on or what will be going on in the future. The easiest way to study the data is using zip code related information. So if we focus on the Edmond zip codes, as opposed to Edmond proper, we can see what's happening. Unfortunately, this is the best data we have available to us today, and I'll get into a little of that a little bit later. But when you think about it, Edmond zip codes have a population of about 184,000 people. This is nearly twice the population of Edmond, where the population is just short of 94,000. And you have to understand that the demographics for those apartments in the 73012 and 73013 zip codes closer to the Memorial Road corridor are much younger and more mobile than Edmond in general. We can still use the data. And if you look at this chart, you'll see that the number of cases reported for Edmond zip codes from last March when we started collecting data as a state until this past Monday was 17,803 cases. We've also reported 118 deaths in the Edmond zip codes. We can also estimate vaccinations. We can't give you zip code specific data because the state health department does not release vaccination data on a zip code basis, but we can still estimate it based on total population and use a pro rata formula based on the Edmond zip code population. So using that logic, you can see that we've given approximately 22,350 single doses. And on top of that, we have another 25,491 or so who have received both doses. That's not bad. We're actually probably a little bit better than that, even based on some of the input that we have heard from some of the people working in the local vaccination pods. If you look at a process behavior chart and new case data for the zip codes, and that's how we analyze the data. Process behavior charts are also known as statistical control charts. You can see right here that we were averaging just over 220 new cases per day in the first week of January of this year. That was our high point. And you will also see that we started dropping about the second week of January. And every week or two, we've continued to drop until on February 25th, we entered into, I guess February 26th, we entered into a new cycle of statistical control that shows that we're averaging 28.8 new cases per day in the Edmond zip codes. The variation that for the cycle we're in now is slightly larger than the previous cycle or the one before that, or even the one before that, but it's not bad. You always will have some variation on a day-to-day basis. You can actually see these two data points here, and that was actually the state who decided to play catch up with some reports they'd missed, and instead of putting them back here on the days where they actually occurred, they just threw them in here on 2 days. But we look at this, we see it going down, and we can actually explain a lot of that because we had a slowdown after the holidays where people just weren't gathering as much together. And then we started getting vaccinations as a really strong mix in this. You know, we're estimating that we've had about 25% of the community when we hit this date here, about 25% of the community had either had the virus or had been vaccinated. And today we're sitting right around 35%. I've been asked several times, does that mean that we're starting to get herd immunity? Do we have herd immunity? The simple answer is no. Are we getting closer? Yes, but we aren't there yet. But the number of vaccinations are definitely having a positive impact on the number of new and active cases in Edmond. Now that's the good news. You can take it even further and you can look at what we currently have, and I've blown this up a little bit so you can see it better, but you can see where we are today at 28.8, and you can compare that to last summer, first when the business posting policy, that private policy decision that the big box stores made. And what happened was they implemented their policies. The city implemented the business posting policy, and we dropped about 2 weeks later from 31 to 14, a little over 14. When that happened, we wanted to see what would happen with that long term, but the city council passed the mask mandate before we got a chance to see the effect of it. And when the mask mandate policy kicked in here, right here, you see we jumped back up. But that wasn't caused because we made people put on masks. That occurred because UCO started classes and the Edmond Public Schools started classes. And we started seeing those cases reported from both the university and the school district. If you want to look at the way that kind of works its way through the system, back last summer, we were actually analyzing the data within the city limits itself. So we can take that zip code data, we can compare it to what we were doing last summer, and you can see that when we passed the business posting policy on July 13th, that the zip code data for new cases daily was at 31.0, and new cases within the city limits was at 15.9. When the mask mandate took effect on August 26th, we had 30.5 new cases a day in the zip codes and 16.2 inside the city limits. Today, we sit at 28.8, and if we use a pro rata formula on it, we're about 14.7. So it says we're doing a little bit better, and that's a good thing, but there is some caution in that. What Dr. Ward and I prefer to do is we prefer to look at hard data, understand what's happening, and make decisions when we know for a fact that what is going on has really not only made a positive impact, but is in control statistically. So we believe that we're looking for another signal still showing another decrease in daily new cases. And then it's got to remain in control for a significant amount of time. When I say significant, that means 2 weeks. We're just saying once we get the baseline done, we need another 2 weeks of data. What we're really looking for is to try to get us under 11, which would put us back before we really started the climb back in the early summer. If we could reach that number, we believe that would be the right time for both public and private policies to start loosening up. However, we have a problem. And the problem is the state health department first kind of took our legs out from under us in late January, when on January 25th, they announced that they would no longer provide address-specific data to the city of Edmond so that we could do our own analysis on Edmond proper. Then they turned around this week, and on Monday, they announced that they were no longer going to update the state health department pandemic dashboard daily. They're only going to do it once a week. By doing that, they took the one thing that local municipalities actually had to analyze new case data and know what was happening in the local community away. What that means, local governments may wind up 4 to 5 weeks behind before they recognize that action should have been taken to address a surge. It's frustrating to us. I know it's frustrating to the city. Where does that 4 to 5 weeks come from? Well, it's pretty simple. If you had a group of kids come back from spring break and they've been exposed to the virus, and 2 weeks later they come down with it and they start passing it around, and it's another 2 weeks before we realize what's going on and we take action at that point, we've got a whole nother group that's spread right before we took action. So if you think about it, yeah, a new surge could occur simply because we can't tell what's happening on a day-to-day basis. We want to be able to help the city. I know that our city leaders want to be able to stay on top of this and make good, informed decisions. What I'll tell you in closing is, if you like what I've just shown you, if you'd like to see more of it, we need help. We need you to contact your state legislators and tell them to contact the state health department and demand that the data be posted daily on the state dashboard until this pandemic is over, not just change the rules when they feel like it. If you want to know more about this analysis or what we at Pinnacle Partners do, please email me at marknash@ppwest.com. Thank you.
Thanks, Mark. I appreciate you doing that and taking that time for us. And I know that you've been really busy, and the mayor and council have been looking at your numbers, and we appreciate all that you do. We have just a little bit of time, and if you wanted to use the, I don't know if we've got, Casey, the raise hand function or what, if we can recognize anybody for questions.
Yeah, we'll do raise hands. So if anyone has a question, you can use the raise hand feature. That's in the participants tab, or you might find it under reactions. If you've phoned in, you can raise your hand by hitting *9. And so you do have your first hand raised here. So we'll go ahead and bring that person up.
Hey, Tim, this is Josh Moore. How are you?
Doing good, Josh. How are you?
Good. I just wanted to jump on. I don't have a question for Mark, but with the group, I wanted to thank Mark and let everybody know how helpful his information has been during COVID, at least to me. And I've been thankful that he's included me in on his statistics and his emails that he's been sending the mayor as well. And so along with like Oklahoma County Health Department and some other information that we get during the week. Just really wanted to thank Mark for what he's done for us. It's been super helpful. So thanks, Mark.
City staff, we declared last March the annual, the importance of the emergency management program for the city. It's part of a routine thing. I had no idea how important they would be. Matt Stillwell has been working very closely with us and staying in touch with the county health department, and keeping us in touch with what's going on. We've participated in a lot of meetings, and certainly our city attorney keeping up with the Governor Stitt's frequent proclamations, shall we say. It's been, we've issued, I think, about 15 different amendments to our emergency proclamation as a result of changes by the governor and transitions. And I tell you, I've got to thank the governor for his leadership on this particular thing. He's kept it even keel and provided good, strong guidance for a state that has a wide variety of situations. From the big cities like Tulsa and Oklahoma City, his programs allowed them to continue their uniqueness, do things that were important for their community, and for the areas where literally they have no cases at all in counties out in western Oklahoma. So that's sort of a difficult job, but the EPS program I thought went very well. We can look at the results now. It was implemented in 3 phases, and it became effective finally on phase 3, May 1st. So that's worked pretty well, and everybody seems to be appreciative of the guidance that we had. And looking back on it, we didn't know for sure, but it did a great job at that time. And there's a whole lot of people involved in it, but I really appreciate the effort of Mark and his associates at the company to give us some free guidance or professional guidance associated with this particular pandemic and how it was impacting our community when we made decisions. Thank you very much, Mark.